have hepatitis and HIV screenings every 3 months to act as a intervention and prevention model. The targeted health education workshops will be conducted at each site to educate both groups about hepatitis C staging and treatment, and specialized intervention and prevention health education workshops will be conducted at the collaborative treatment center location. So if we have collaborative groups with night ministries or testing vans, we will also be doing some levels of health education with those groups. We will be programming our staffing needs with a project manager for both groups, one health educator and a patient navigator and a patient outreach navigator. And what I've added to include is a health educator who will also be specializing in social marketing and social media marketing for the text-to-text messaging or follow-up messaging program. And our patient outreach navigator may or may not be able to do phlebotomy work. If not, we will include a phlebotomist for our outreach efforts. So a memorandum of understanding has been established for our program locations that we will start with, our EMR prompt, our opt-out consenting, and our recruitment for our text-to-text programs, follow-up programs. And for our baby boomer group, we have John Stroger Hospital, the ER waiting areas and the patient areas, the Core Center, which is an STI clinic, the Pelson Wellness, which is our bilingual clinic to approach our bilingual group of people, especially with us not having necessarily a bilingual health educator at the time. They do have health education groups that we will be a part of. The Gen X, Gen Y, we will be targeting the Haymarket treatment facilities, women's outpatient waiting areas. I do believe we are working on a memorandum of understanding, an MOU, for the men's outpatient waiting areas. And then also the night ministries who have harm reduction testing vans that will go throughout various locations. We have a memorandum of understanding with them as well. So our program evaluations. So for the baby boomers, the Kirkpatrick 4-level evaluation will be used to assess whether the one-time opt-out screening and education track of this program encourages more baby boomers to get screened, which will increase HCV testing numbers. Part of our program manager's job description will be to identify these testing areas that need to have an increase in this particular group's population, and we will be doing this particular 4-level evaluation where we identify these groups, where they're located. We know that many of them are unaware, so that's where the health educator comes in. We'll be doing the workshop and risk assessments to make sure that they understand why the opt-out screening is happening. And then our results is that after education, more of the baby boomers will feel comfortable having the opt-out screening. They will not refuse it. And they only need one screening to find out if they've been exposed, unless their behavior, unless they present a risk behavior, in which we would then talk about more screenings and treatment options, prevention options, I'm sorry. The logic model for Gen X and Gen Y is a little different, and we will be using Gen X and Y groups to assess whether routine opt-out screening for hepatitis C and education will serve as an intervention and prevention for behavior change. And what that basically means is that we know that Gen X and Gen Y is part of the new increase of new infections, which means that there is a current behavior that we want to approach and want to change. So that means conducting education workshops on harm reduction methods, prevention methods, and treatment referrals. Then we would do the we would do the routine opt-out screening using the social marketing text-to-text follow-up reminders so that people who are currently using or who have expressed that they have used in the past or in treatment facilities will have this reminder so that they would come back and get screened, and we would report the data to see if that increases the testing numbers but also decreases the amount of people infected with HCV and or HIV. One of the things that we are looking to do is also implementing referral methods in the text-to-text follow-up as we design what that actually would look like. Would that be something that's going to the phone? Will it be a social media sort of inbox text? As our health educator is the social media, it has a specialization in social marketing and social media. Will design that to figure out what's the best way to contact people to get them in for the routine 3-month testing. Our hopes is that this will encourage those to want to change behaviors because of the reoccurrence of the testing. CQI data will monitor the 2 tracks of the opt-out, opt-in HCV program because they overlap, but the quality improvement measures will be done separately and quarterly. Conducting CQI will ensure that both tracks evaluation models are completed and ensure intended outcomes are met or have clear indicators as to why they were not. We're going to be asking the question for each track, so the baby boomers and the Gen X, what's working, what's not working. This CQI data will be part of the program manager's responsibility, especially as we are looking to continue with the Gen X, Gen Y track beyond the 1 year. For funding, we want to make sure that we are making sort of a dent in that increase in HCV infections. Hepatitis C is the most infectious disease in the United States, with over 3 million people infected. The tale of 2 epidemics is that of baby boomers and Generation X and Y, who are disproportionately affected and are part of an alarming increase in new infections. As with HCV infection, coupling both generations into this epidemic, as with the HCV virus coupling both of these generations into the epidemic, so should the education and prevention methods, so that we can address the problem aggressively and then use more resources. We do know that for both tracks of this health education program, we will be overlapping a lot of our behavior methods. A lot of our needs will be the same, but for both of them, they should have 2 different results. One in which the baby boomers will be more educated, we'll get more of them identified, and more of them aware of their status. And then we will intervene with people with Generation X and Y to maybe stop the increase of new infections based on the opioid crisis, as we are also trying to treat them for their addiction. For more information about hepatitis, please check out this educational video that our health educators will be playing during our educational groups. This was developed in 2015. A couple of things have changed, but basically it gives an overall view. It actually isn't subtitled in Mandarin that I created. It gives an overall view of hepatitis and what people should know about the virus, and what to do to stay healthy and how to protect yourself. If you have any questions, you can reach me at my contact information. Thank you again for allowing me to give you this presentation on